Yeah, good afternoon. The study I'll be presenting was performed in collaboration between Visiopharm and Aarhus University Hospital. And the aim of the study was to determine how detection of non-invasive and invasive structures in breast carcinomas would affect the Ki-67 assessment scores. And basically, the idea is to run the hotspot analysis on whole slide images with both invasive and non-invasive structures and without the non-invasive structures, to see how that affects both the position of the hotspot and the actual assessment score. And the whole slides images were of two. We had two different serial slides. So one with the Ki-67 stain, and then a second slide with the physical double stain of the P63 and cytokeratin stain to identify the tumors, and then to further identify the non-invasive structures. So the workflow of this was to first detect, to do a virtual double stain using the CE, IVD, and clinically validated virtual double stain technique. Then to use this to determine the areas of tumor and non-invasive structures. And you can see that by, so we detect these, and then we can transfer that information into the Ki-67 images. Then we do a hotspot analysis, so measure the density of the Ki-67 ratio between positive and negative cells, thereby producing a heat map of this of the scores, so getting the high scores. And we could see that in 20% of our whole slides, we found the hotspots in a different position when we, or including the non-invasive structures. So that affected the scores and the outcome. And we could see that if we replaced the cutoff at 20%, we could see that 5% of the samples actually changed clinical outcome. And we didn't see any bias, so we didn't see any over or underestimation of the scores when we compared the results with the blind Altman scores. And then comparing these data with manual scores, we didn't find any bias between the methods. So that was, of course, what we hoped to find. So there's no bias towards either positive or negative scoring. We did, however, see a change in the clinical outcome if we chose that cutoff of 20% in 16% of the cases. So it's relatively high sort of category treatment category change, which surprised us a bit. So the importance here, take-home message, is that it is important to think about the non-invasive structures when you look at the Ki-67 hotspot scores, because it will affect the results and possibly the treatment choice that you will make. Yeah. And if you want more information, come visit me at my poster or talk to the guys at the Visiopharm booth. They will also be happy to answer questions. Thank you.
Thank you. Do you have any questions? Questions? I have one short. So you apply this approach of basically delineating the tumor and then scoring in Ki-67. Do you think a similar approach of finding the tumor first and then counting mitosis would be also beneficial in H&E? Counting mitosis in H&E staining?
Yeah, for sure. So, and also, I mean, also the hotspot, you could also think about adding to change to look at where do you actually have localized H&E.
Any other questions?